The aims of my presentation are first, to explain why glucose-lowering medication is so often needed by patients with diabetes. Second, to outline the different ways in which diabetes drugs work. And third, to consider the pros and cons of some new agents and why they are of interest for older people with diabetes. So why are glucose-lowering drugs so often needed to control diabetes? Well, the main issue is that diabetes is caused by a lack of insulin, and so most people will need medication sooner or later. This is because insulin production falls over time, making control of diabetes progressively more difficult to achieve. Eventually, insulin treatment is required by many people when the pancreas is no longer producing enough of the hormone. How do diabetes drugs work? The first point to note is that several types of glucose-lowering drugs are available. Some, such as the sulfonylureas, which have now been in use for more than 50 years, increase the amount of insulin produced by the pancreas. Others, such as metformin and pioglitazone, improve the glucose-lowering action of insulin. Another drug, acarbose, reduces intestinal glucose absorption, but is rarely used in the UK. What of the new drugs that we now have at our disposal? Let's start with the gliptins. Several agents in this class are now available. They all increase insulin production, but importantly, they only do so when blood glucose levels are elevated. The gliptins are orally active agents that are suitable for many older patients with diabetes. They don't cause hypoglycemia because insulin production is switched off when blood glucose levels fall to normal. Another advantage is that, unlike some other diabetes drugs, gliptins do not cause weight gain. The gliptins can be usefully combined with many other types of glucose-lowering drugs as required. Like the gliptins, the GLP-1 agonists increase the production of insulin by the pancreas. The currently available agents have to be injected, but they have the advantage that blood glucose monitoring is not usually required. Not only do these agents lower blood glucose, but they often produce a useful reduction in body weight. Like the gliptins, they carry no risk of hypoglycemia. However, a proportion of people experience troublesome nausea at the start of therapy. Although this usually subsides after a few weeks, some people find that they are unable to tolerate these agents. In recent years, the challenges of insulin therapy have been significantly reduced by improvements in insulin preparations and user-friendly delivery devices. However, insulin still needs to be injected at least once a day, and in order to provide the best glucose controls, multiple daily injections are often required. Insulin treatment usually has to be combined with blood glucose monitoring in order to ensure safety and guide dose changes. Several types of analogues are available. These range from once daily long-acting preparations to others with a rapid action that are injected before meals. Premix combinations are also available. Analogues are generally more convenient to use than conventional insulins, and they carry a lower risk of hypoglycemia. And so, to summarise, several new types of diabetes drugs have become available in recent years. These are suitable for many older people and have generally made it easier to manage diabetes. Finally, new types of diabetes drugs are in development. It is hoped that these will prove to be useful for older patients. However, rigorous clinical trials will be required to determine their efficacy and safety.